today is mostly going to be live so that I can answer any questions, kind of give some real-time examples and stuff like that. Section 6, I was not extremely thorough with in the notes section because there's just a lot of information that it would be too much to write it out. I might as well just tell you to go read the chapter. But for the most part, it's beyond just birth control or trying to get pregnant. Also, my husband is playing Call of Duty in the background, so if you hear that kind of stuff, that's why. So this is just beyond regular birth control, beyond pregnancy achievement. Like, why else should you chart? What if you're not in a relationship? What is the benefit of doing it, essentially? And the first part is pretty much just maintaining your gynecological health or your reproductive health. Something's funny back there. You having fun? So with this one, like I talked about before, figuring out that you have PCOS, endometriosis, or just anything else that's kind of going on that's funky with your cycles. If you're charting, it makes it a lot easier to figure out what's going on than if you're not. So, for example, if you always know what your cervical fluid looks like on any given day, like you know what's normal for you, then you would very easily recognize when it changes because you got an infection like, a yeast infection, bacterial vaginosis, both of which are extremely common. They happen to everybody at some point. And if you're not tracking, all of a sudden you're itchy, smell weird, and have a funky thing going on down there, but you don't know if it's normal or not. Is this normal? I don't know. If you're tracking, you know for a fact it's not normal and exactly when to go get treatment for it. Yeast infections, you can treat over the counter. Bacterial vaginosis, you need to go get an antibiotic for, so you need a prescription. You can also get a prescription called diflucan for yeast infections, but only if you are not pregnant. If you are pregnant, at least in the second or third trimester, it's generally deemed okay to take if you're having chronic yeast infections. It's better to take the diflucan than not. But if you're pregnant, it's best to just do the over-the-counter 7-day Monistat because that is safe in pregnancy. Diflucan as an oral antifungal is not. So keep that in mind. But charting for your gynecological health, knowing what is normal, what is not normal. You can figure out on your cysts. So this gives you an example when you're checking your cervix that you might notice little polyps or cysts and things popping up, which is, totally normal. They can resolve themselves on their own sometimes, and sometimes they're not. When you feel them and they disappear on their own, then cool. It's fine. It's good. You don't really have to worry about it. Oh, it was probably just a little polyp. But if you feel something bumpy and weird and it is not going away, then to bring it up at the next time you go see your doctor, or to call up your doctor or midwife and schedule an appointment. So that's why, checking your cervix, checking your cervical fluid, it can let you know if things are weird, if things are odd. It's just good for your regular reproductive health. Normal cycle-related pain versus abnormal pain. You might, when you're tracking, notice that you get cramps right around the time of your ovulation, and that you can mark in your chart with a nice little X around ovulation pain, or you can make it your own little note, and you can see, is it happening around the day that I ovulate? If so, then you know that that's pretty much what's causing it. So that's one of the cool things when you're charting is you can attribute pain, cramping, and things and see if it's popping up at a regular point in your cycle or if it's just kind of a one-off pain that only happened that one time. It makes it really helpful when you're trying to do things like get pregnant and you're trying to see is this normal cramping or is this PMS cramping? Am I about to get my period? It can also let you know, hey, you're overdue for a period and you're cramping, might as well take a pregnancy test because guess what? Cramping, the same exact cramps you feel in the days leading up to your period, that's what they feel like when you're pregnant. Did you know that? Did you know that it feels like you're getting your period when you get a positive pregnancy test? Because I didn't until I got my positive pregnancy test, which I took 2 days before my expected period. I expected it to be negative because I was having cramps thinking I was about to start my period. I did not. I had a positive pregnancy test. So when you're tracking, it helps. Also with like pelvic inflammatory disease, there's a little note on that here on page 284, which is like pain in your lower abdomen. It can be accompanied by painful urination, pain during intercourse, irregular menstrual bleeding, fever, vaginal discharge. That can all be signs of PID, pelvic inflammatory disease. So when you're tracking and you're really taking notice of all of these different symptoms you're having, and you can actually line it up with your cycle, you can just figure out what's normal for you and what's not normal and be able to bring that up with your doctor. Being able to do those small little things can make a big difference. I was talking to my mom just tonight, and when I showed her all of my Substack, and she like did not know as much about menopause as she thought she did. And she's learning about it now as she's going through perimenopause. And I'm like, Mom, guess what? One of the chapters I'm going to talk about tonight is on menopause. And I asked her, I'm like, did you read this book cover to cover when I told you about it? And she said, no. I'm like, you need to. You need to read this book cover to cover, because I felt angry at the fact that I did not know all this stuff beforehand. So anyway, along with maintaining your reproductive health, you want to do regular self breast exams. There is a page, so content warning here, nudity depicted. There is a page here that kind of details exactly how you can do a self breast exam. Pretty much just how you want to stand, how you want to like adjust yourself so you can see what's normal and what's not. And men have their own, yep, andropause, yep. They're testosterone lowers. So there's like, you can do your breast exam whenever you feel it fits in your schedule. They do suggest a particular day. They put day 7 ideally, because you want it after your period, but really before ovulation. You want it to be in a sweet spot of your follicular phase where your breasts aren't really swollen or tender due to the hormone fluctuations that go along with estrogen and progesterone. So you want it to kind of be in that sweet spot after your period, before ovulation. Around cycle day 7 is probably a pretty decent guess of when would be a good time to do your self breast exam. And that's really just because your breasts can naturally become lumpier and swollen and just feel different throughout your cycle because of the estrogen and the hormones that follow through. It's like when you're close to ovulation, you might notice your breasts are like fuller, plumper, higher up. It's weird what ovulation does to your body. There is like an example of like how you can do your own little annual physical exam forms, and it's so cute. She has in here in the back of the book a blank one so that you can make copies. How cute is that? She also does that for like a little note section and the charts. So you can make copies of both a, which one is which? One is a birth control chart and one is a, there it is. One's a pregnancy chart, it says it at the bottom. Pregnancy, and one for birth control. And really the difference is just whether or not you're looking for a positive test or if you're using a birth control method. That's the difference. So one is a birth control method and one is a pregnancy test. So that's really the difference between the two charts. You could use either, really, if you wanted to.
I just bought up 2 real fighters.
This is an example. I really wish I had thought about this, Rhea, when you were having your, when we were talking about going for your first pap smear. But this is an example of what a pap smear looks like and what they're doing during a pap smear, so that you can see when they're like palpating your ovaries to check those out and when they insert the speculum. So if there are any men that ever see this video, be nicer to women. This is what we have to do to get checked out. You occasionally have to get a finger up your bum. We get this like way more often than we ought to. Okay. So in general, just charting is going to keep you informed. It's going to help you stay healthy. It's going to keep you informed about where you are in your body. My mom was like, you need to keep charting even when you're, not using it for birth control because menopause. And I'm like, yes, very much. I plan to continue charting all the way through menopause and all of that fun stuff because it's crazy. Chapter 19 goes over the causes of unusual bleeding, or really just like mid-cycle bleeding that is not caused by a period. I'm so sorry, I was more thirsty than I realized. Okay, so going back to like middle school science here, we have during your menstrual cycle, you're going to experience the first days of your menstrual cycle are going to be bleeding. Now, exactly how many days, it varies. And the book says 3 to 5 is typical. Anything from 2 to 7 is considered normal. Really, I mean, I know plenty of women who had periods as long as 7 to 10 days, and that was their normal. So I would say as long as it's 10 days or fewer of bleeding, you are probably fine. You are probably having a typical period. Now, do keep in mind, any day after like cycle day 4, you should assume you're fertile. So even if you were still bleeding like the Niagara Falls on day 10, assume that you could get pregnant if you have sex unprotected on day 10, because that blood could be masking your cervical fluid. And that cervical fluid exists in your cervix, not your uterus. So while the uterine lining is shedding, sperm can hide out in those little sections in your cervix where cervical fluid is produced and be protected from that blood that is escaping through. So that is why you have to assume any day after cycle day 4. The book says cycle day 5. I say cycle day 4. Anything after cycle day 4, assume you are fertile. Because that blood does not protect you from an accidental pregnancy. For the most part, you're going to experience like a pattern of either like light bleeding into heavy bleeding and then back to light, or you're going to start off heavy and then go to light. Those are the two typical patterns most people see. You might be one of those people that experiences like a light spotting, heavy, light. You might be any variation thereof. That is all pretty normal. When it becomes unusual is when it's like in a weird part of your cycle. So for example, this is ovulation spotting. Ovulation spotting is going to be a bit of spotting, like basically a dot in your underwear or a light pink tinge when you wipe. And it's likely going to be mixed in with egg white cervical fluid. So you might notice when you're checking your oil and that oil is thin and stretchy, you might notice a pink tinge in that oil. I love that euphemism. I'm sorry. If there's that little pink tinge, that's ovulation spotting. Super normal, super common. You might notice, if you notice like a long cycle, no ovulation, but then you start bleeding, that's called ovulation bleeding or ovulation or anovulatory spotting. Anovulatory bleeding or anovulatory spotting. A period happens when you release an egg. So a period only happens after a successful ovulation. That is because it is ovulation that promotes the progesterone rise, that rises your temperature. And then when the corpus luteum, where the egg releases and that follicle turns into the corpus luteum that releases the progesterone, when that corpus luteum dies off, progesterone drops, your period starts. Without ovulation and that progesterone, you cannot have a period. That is the difference between a period and anovulatory bleeding. In an anovulatory cycle, you would not experience this temperature rise. It would be like that. You would just have this and then bleeding. You would not see a shift that would indicate ovulation. So that's the difference. If you notice that your temperatures never rose and you start bleeding around here, that's anovulatory bleeding. That means you did not have a period, but it might look like a period. It could feel like a period. You could have cramps. You could have heavy bleeding. You could need a tampon or a pad or whatever. It's not a period because you did not ovulate. And as a matter of fact, you could ovulate during the bleed. So that is one of the reasons why you cannot really trust the first 5 days are safe, because the first 5 days of an anovulatory cycle are not safe. The cycle before I got pregnant with my son was anovulatory. I did not have ovulation. I started bleeding the day that I found out my brother had passed away. And then 9 days later, I ovulated. So if I had, well, I did because I was actively trying to get pregnant. So I was trying to get pregnant. I purposefully had sex around ovulation when I noticed I was having the egg white cervical fluid. And that started on what would be cycle day 7, because it wasn't really a new cycle. It was still part of my old cycle. I just had an anovulatory bleed. And you can start a new chart with an anovulatory bleed, but never assume that you are safe those first 5 days. If you're trying to get pregnant, that means, have at it those first 5 days. If you're trying not to get pregnant, which is what I think the two primary people currently in my chat room are, not trying to conceive at this particular point in time, then I imagine you'd want to wear condoms or abstain during the first 5 days. Now, I have a little bit of things to say to Toni Weschler on this one and one only thing, really. Implantation spotting does not exist. Implantation spotting is a misnomer. What that means is it's not actually implantation that causes the bleeding, although that's what she describes here. She's careful. She says it may be implantation, like she puts quotes around it. A little spotting may occur. She's careful with her words because this was hypothesized. This was not proven. There have been studies, which I have linked in my Substack post. If you go into part 6, there is a link for Ava Women, which links to an article from the makers of Ava Bracelet. And they actually cite 2 different studies. They are small studies, but the information is still very relevant and important. What they discovered is that any instances of bleeding after a positive test occurred, like anything that could be considered implantation spotting, occurred a minimum of 5 days after implantation could have happened. So as a result, you're not going to attribute bleeding that happened 5 days later from bleeding that occurred when implantation. That doesn't make any sense. Implantation occurs, you would expect the same day to experience spotting, right? It's because it's not the same thing. What they think it really is a temporary drop in progesterone that might result around the time the corpus luteum dies and the progesterone from the pregnancy takes over, because it's going to be a little bit. When implantation occurs, that signals your body to continue to produce progesterone, and it keeps the corpus luteum alive. Now, until the placenta can take over. Now, if that corpus luteum starts to die before implantation occurs, then there might be that little dip in progesterone, or it just might take a second. Whatever the case may be, that's the hypothesis now, is that slight dip in progesterone causes a slight bleed, which happens a few days after implantation, most commonly 5 days or later. And they call it implantation spotting because they don't know what else to call it. The other reason they gave for implantation spotting is, well, we don't know. It's unexplained. So if you ever hear a doctor refer to implantation spotting or implantation bleeding, they're really meaning this is bleeding that happens because we don't really know why. It is equally likely to lead to a miscarriage. Like, bleeding in pregnancy is not a positive thing to see. You don't want to see blood when you are trying to be pregnant. So this felt like a myth that got started on Trying to Conceive or TTC forums of a confusion of ovulation spotting and that weird little bleed that occasionally happens to like 15% of women or who get pregnant. It's not a common thing, but it's common enough to get talked about. And because I just don't have an answer for it, but They'll also use implantation spotting to refer to bleeding that happens at like 5 weeks pregnant, 6 weeks pregnant, 7 weeks pregnant. And it's like implantation happened at like 2 weeks pregnant. You can't attribute bleeding to something that happened 3 weeks ago, bud. It drives me freaking batty. So that is my one caveat about this chapter that irritates the fuck out of me. Breastfeeding spotting, kind of the same thing. When you're breastfeeding, your hormones are all over the place. You might experience that kind of shift, and you might get some spotting and bleeding in between. It's going to be anovulatory until you actually ovulate. So you might experience, when you're breastfeeding, a mix of anovulatory and ovulation spotting, depending until that ovulation actually occurs. Hormone therapy can definitely produce spotting. And then if you notice that your discharge or your spotting is dark brown or black, that really just means it's old blood. So by the time it actually reaches outside your body, it's already been exposed to oxygen, which turns it from that bright red to dark. So when your uterine lining starts to actually slough off and come out during your period, it pretty much starts coming off all at once. So all of that blood takes days to come out. That's why near the end of your period, it's more dark brown or black. I remember being like in middle school and my friends freaking the fuck out during her period. I had a friend cry, being like, I don't know what's wrong. And I'm like, girl, it's fine. It's just old. It's just old blood. You're good. She thought she was dying. I'm like, no, you're good. You're totally fine. You can also experience clots, which are so very disgusting when you don't know what they are. For the most part, they're not a concern. They're more common if you have endometriosis or PCOS, but they do happen to everybody. Sometimes we just have a really bad period. Sometimes we experience a miscarriage. Sometimes that miscarriage is a chemical pregnancy, which is basically a really, really early miscarriage, one where it was, implantation occurred, it turned a pregnancy test positive, and then immediately you started bleeding. I have had one of those miscarriages. They're not fun. But also, if I wasn't trying to get pregnant, I wouldn't have known it was a miscarriage. I would have thought it was a period and probably would have been relieved. Any user. You can also pretty much, if you're charting, know if you are experiencing problems with unusual bleeding, like if you're bleeding irregularly or way too frequently. One of my friends who has PCOS, she was bleeding every 2 weeks. She was like basically getting a period every 2 weeks, lasting 2 weeks. Every 2 weeks, she was having a 2-week long bleed, and it was crazy. She was like anemic too. She still has some issues, but I think for the most part she's got a lot of it under control. Like me, she found things that worked for her. You can also take a look and see if you're experiencing issues with your cervix. Cervical erosion can be very serious if it's not caught in time. When you get used to checking your cervix, it's one of those things that you can really just know what's normal and when it starts feeling weird. Luteal phase insufficiency, that can also result in spotting, pelvic inflammatory disease, endometriosis, fibroids, all of that fun stuff. There's this lovely little chart on 298, 299 that kind of goes over all of those different causes. But really, for the most part, the majority of the time, it's going to be something like anovulatory spotting or ovulatory spotting or your period. Those are the 3 primary times you're going to experience spotting. Chapter 20 is a lovely chapter about relationships and sexuality. Did you know that there are 10 to 15% of women who have reportedly never had an orgasm? Ever. In their lives. Please, for the love of God, learn how to give yourself an orgasm if you don't already know how. Showers and baths are your friend if you don't have access to vibrators. There is plenty of erotica. There's plenty of how-tos. Please, please learn to accept your body and to be kind to your body. And this has wonderful suggestions on finding the elusive G-spot. There is examples of how you can enjoy different teasing with your partner, different lubricants you can try. Also discusses why it might be difficult to orgasm and what you can do about it. There's also positions that she should suggest that can help offer the best types of stimulation. She does offer a little section here on female ejaculation, aka squirting. So these are all things that you can check out in chapter 20 of Taking Charge of Your Fertility. I'm not going to go over all of them here because of, you know, trying to keep this a little bit safer work.
Not yet.
But birth control, oh, this part is really important. Before I get into that, okay. One thing is one of the reasons you might feel sexier mid-cycle is ovulation makes you want to have sex. Ovulation makes you want to procreate. So you're going to feel sexier and hotter, and you're going to like the way you look around ovulation. And then you might find that after ovulation, closer to your period, sex like hurts more. Your cervix is lower. So, like, fun fact, your vaginal canal at rest is usually between like 2 to 4 inches in length. And then when you're sexually aroused, can extend between 4 to 8 inches in length. That is why the average penis is between 4 and 6 inches long, because the average vaginal canal is between 4 and 8 inches long. Fun facts. So at certain points in your cycle, when your cervix is lower and your vaginal canal is naturally at rest lower, it might take a little more sexual arousal before you actually start to be prepared enough to enjoy sex. And certain positions might feel more uncomfortable if you're not adequately prepared. Birth control can affect your sexuality. And I mean that in terms of not who you're attracted to, but how often you are attracted or desire sex. Birth control can tank your sex drive. Not only can it affect your sex drive, it can also cause chronic infections, and it can also cause suicidal ideation or behavior. How do I know this? How do I know this? Guess who was on birth control from the time she was 17 until she was 21? How do I know this? Yes, I did not like being on birth control. I remember crying, going, I just wanted to not get pregnant. I didn't realize birth control was going to make me not want to have sex. Not only did birth control not make me want to have sex, it made me think I was asexual. I had zero desire. Zero. So, I have a big problem with birth control. If you have not watched it, there is a documentary called The Business of Birth Control. Highly recommend it. Did you know the NuvaRing has killed women?
Oh, I got tagged from
Did you know that there is a black box label warning on the NuvaRing and many other birth controls? And that the Implanon, the Nexplanon, whatever one that gets like inserted into your arm, that can actually get lost in your body, and if it does get lost in your body, they cannot retrieve it. I have problems with the options we are given for birth control and that men are not. So I am pretty much forced to go the fertility awareness method, because when I am on birth control and I have tried numerous types and I do not feel comfortable with other types, I'm required to either get sterilized, have my husband get sterilized, or forever use the fertility awareness method with condoms and or abstinence / withdrawal, because there is no other alternative for me that feels safe. And I imagine a lot of other couples feel the same way. This kind of talks about how men can really get involved in the fertility awareness method with their partners. Frankly, I personally did not find that to be extremely helpful myself. I enjoy talking about it with my husband, but I don't like have him be involved in the actual part of it, other than I just let him know whether or not he needs to pull out or use a condom. Or if we're skipping today because of reasons. All right, chapter 21 is about PMS, premenstrual syndrome. No, it is not all in your head. There are different types of PMS. There's the kind that makes you depressed, irritable, anxious, angry, tearful, panicky. Then there's the kind that causes behavioral stuff, like where you're impulsive, where you're agitated, or you might be lethargic. You might have a decreased motivation to do things. Then there's like where you feel nauseous, constipated, dizzy, tremors, blurred vision, bloating, water weight, restfulness, hands and feet swelling, pains. There's a whole bunch of different things, cognitive, dermatological, all of these things that are different types of PMS symptoms. I'm just going to pop this up here for a second. And men have a 24-hour reproductive cycle. Women have a multi-day, 28-plus day hormonal cycle. So we really experience the PMS symptoms primarily after ovulation, before and leading up to the period. You might start feeling better around your period, or it might be in the few days after your period that you really start feeling better, when the cramps are all gone and all of that. The difference between PMS and a disorder like PMDD, which is premenstrual dysphoric disorder, is that PMDD severely interferes with your life in virtually all facets of your life. So it's a really severe and intense form of PMS. It only occurs after ovulation, and one of the primary markers of it is that it gets better almost immediately upon the start of your period. So I originally got misdiagnosed with PMDD before I got diagnosed with MDD, major depressive disorder, anxiety disorder, and later on ADHD, and currently in the middle of an autism diagnosis. So fun fact, most women with ADHD and or autism first get diagnosed with depression, PMDD, or bipolar disorder, because doctors don't know how to recognize ADHD and autism in women. Anywho, so you can pretty much figure out by charting when you start noticing your PMS symptoms. Like this person, for example, has written down what their usual symptoms are, like even chocolate cravings. And they've marked down when they start, which is a couple of days after ovulation, and they stop almost immediately upon the period. So that's one of the ways that you can really check if it's PMS or something else. This gives you ways that you can reduce your PMS symptoms, and they're pretty standard: stress reduction, rest, exercise, yoga, non-prescription drugs, yada, yada, yada. All of that typical stuff we already know about. Chapter 22 is on demystifying menopause. So, lovely ladies, this might not be for you too, but it could be very helpful for the other ladies in your life. There are multiple parts of menopause. In the strictest sense, it refers to the permanent ceasing of menstruation. This is because basically you're out of eggs. Your ovaries have stopped producing mature eggs. Whether or not they still exist within your ovaries, your ovarian function has ended, and they're no longer functioning to the point that they are producing mature eggs in order for you to menstruate. So that is menopause. Premenopause pretty much refers to the years leading up to menopause. It can also mean any time before you go through menopause. So we are premenopausal women, if you are any woman not currently in the stage of menopause. Perimenopause is the years immediately prior. So say a woman who starts menopause, like she gets her very last period at age 50, and that is the last one she will ever have for the rest of her life. Ages 49, 48, 47 are perimenopause to her, because they are the 3-ish, it doesn't say exactly 3 years, just says the years, so I'm using 3 as a standard. 47, 48, 49 would be perimenopause to a woman who started menopause at 50. There's 2 other terms here which are dated terms that are now replaced by the correct term, which is primary ovarian insufficiency. This is the term that refers to the loss of function of ovaries that causes menopause prior to the age of 40. So premature menopause has been replaced by primary ovarian insufficiency, but that's pretty much what it is. If you are experiencing menopause or perimenopause symptoms prior to age 40, you are experiencing primary ovarian insufficiency. And if you are trying to get pregnant, that is a huge problem. The sooner you can identify potential premenopause or perimenopause symptoms, the faster you can get treatment with a fertility doctor. So classic signs of impending menopause, your menstrual cycle changes. They'll get kind of either shorter or longer or some kind of mix of the two. You'll get hot flashes. My mom is currently experiencing those hot flashes, and I'm not gonna lie, it's a little funny to watch. I'm saying that now. I'm sure I will not be saying that in 20 years when I start having hot flashes. And then you have the vaginal dryness because you're not ovulating anymore. Your vaginal fluid, your cervical fluid, that's its sole purpose really is to get you pregnant. That's going to start drying up because there's no egg, there's nothing to help you get pregnant. So what's the point of the cervical fluid for the most part? So these really are signs rather than symptoms because menopause isn't a disease. It's just something that we all go through. It's a natural course of our life cycle. And for the most part, these are just simple signs. Your menstrual irregularities, approximately 80% of women will have some kind of cyclic change in about 7 to 10 years before is on the like super early side. So say you are expected to start menopause around age 50, around age 40 to 43, you might start to notice changes in what is your normal menstrual cycle. If you have regular 28 to 30 day cycles, all of a sudden you might notice that your cycles are either getting shorter or longer. That will just vary on the person. Hot flashes, there are a very lucky few who manage to go through menopause with no discomfort or very little discomfort. Most are going to experience some hot flashes, at least some. They may persist several years, they may last longer. The episodes may last a few seconds, a few minutes. They may occur once a week, every day. You never know. It's just one of those joys of being women. Now, one of the things is if you're charting, it's easy to recognize whether you're experiencing a long cycle due to irregularities like premenopause or perimenopause, or if you're experiencing cycle irregularities because you're pregnant. So that is why I also recommend you continue to chart because up until menopause, your very last period where you are no longer ovulating, you could get pregnant. So even that very last ovulation at 50 years old, you could get pregnant. Chart, just do it, just chart. Oh, in fact, it does say down here, if you are experiencing perimenopause or approaching menopause, ovulation predictor kits are practically worthless. Don't bother. Hormone therapy can help with menopause signs. Just know that that's going to be really between you and your doctor. You can still use fertility awareness for birth control during the premenopausal years. So I recommend it. I highly recommend it because even if you are somebody like my mom who ended up having a uterine ablation, that's where they essentially cauterize your uterus so that it's still present within your body, but it's not going to hold a lining anymore. And as a result, you don't experience a bleed. You still have your ovaries, you still ovulate, but you no longer have a period. You no longer have the actual bleeding signs of a period, but you still experience the hormone fluctuations that result from your cycle. So somebody like my mom, she was experiencing a period, but didn't know when she was PMSing versus just having a normal Tuesday. And I used to tell her, I'm like, Mom, you really should try to track. You should just check your temperature because then you would know when you're ovulating and you would know when you're having a period. She never did. I'm still mad at her for that. She should have listened to me, which is what she tells me all the time. So, Mom, when you listen to this, you should have listened to me, because then you would have known when you were approaching menopause. Ba, 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 ba. Da, 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 da. This just goes over the signs of menopause: decreased cervical fluid, how your cervix position might change. It might be more often firm, closed, and low because it only gets up and it only gets high and soft and open when you're ovulating. If you're ovulating less frequently, then you are probably going to experience more firm, closed, and low. That just makes, logical sense. These are some examples of really what are like my charts. I basically am menopausal. Premenopausal, whatever. PCOS charts look a lot like this. So this is one where it's kind of like a delayed and you have multiple patches of wet cervical fluid where she has like her baseline is just wet all the time, but her vaginal sensation goes from dry to wet to dry to sticky to wet. And you can see where she's jumping up, where she's experiencing more creamy cervical fluid than sticky or dry. But once she gets up here, where it's like egg white, see, it never reaches egg white up until she actually ovulates. And that's where she experiences a lubricative vaginal sensation. She experiences all of the egg white fluid for 2 days, and she goes from wet to lube. So lube is her peak day, because that is the last day of both her most fertile cervical fluid and her most fertile vaginal sensation, which is pretty much, are you dry, wet, sticky, or lubricative? And then she marks when her period starts, which it started a normal time frame. This person down here, they had a very typical, very dry, and then sticky, wet lube. This is a very standard chart, just a late cycle. She didn't ovulate until cycle day 27. Again, this is typical for me, but it's not typical for most. So. And then we have one where they are not ovulating at all. This is currently what my charts look like because I'm breastfeeding. I'm experiencing lactation amenorrhea. So my charts look like this. Lactation amenorrhea, by the way, is when you're breastfeeding and don't experience a period. Chapter 23 is about enriching your self-esteem through knowledge about your body. Basically, the more you know about your body, the more powerful you feel. Knowledge is power. That's really it right there. Knowledge is power. That's what she wants you to know. There's so much that you can do when you know about your own body. I remember being young and having a pregnancy scare despite knowing that the test came back negative. But I was confused because I hadn't had a period in over 4 months. So, like, what the fuck? If I'm not pregnant, what the fuck? All the doctor could say was, well, we can put you back on birth control. Go to a midwife. I had PCOS. Didn't know that. There is an epilogue in here about the history of progress, women's health, and the missing piece of the puzzle. Basically talking about the search for viable contraceptive, using spermicides, cervical caps, pills, IUDs, returning childbirth to mother's control, basically us. Talking about outing menopause and other female taboos, things that we weren't allowed to talk about until the last, 20 years or so. There's now high-tech fertility procedures that make, becoming a parent a little more achievable for those who cannot conceive through natural or standard means. Being able to do IVF is fantastic and amazing and a huge achievement. And the fertility awareness method is about all of this. It's about your sexuality, it's about your health, it's about menstruation, it's about pregnancy, it's about everything. And it is all full circle. There is this lovely insert in the book as well, the color insert that has depictions of what ovulation looks like in both a chart, what it should look like with your cervical fluid, and even your cervix. Isn't that crazy? Like, how cool is all of that? Something as simple as this can tell you whether or not you're going to get pregnant one day. Isn't that neat? And then that is exactly the example of what you should be looking for. Right there. Isn't that funny? Kind of a TMI picture, but... Oh, I love this one. So this is about, here is where your follicle will mature and release the egg. Once it releases the egg, it turns into the yellow body, the corpus luteum, and that's what produces the progesterone. The egg will come out here into the fallopian tube where it is actually hit with a sperm. Then conception occurs. It starts dividing into cells, and then it makes its way out here, and around day 9, it implants in the uterus. That is so cool to me. Just that whole process, because these little things, this is open. These are not attached. So knowing that this little egg has to come out and these little thingies just kind of like, hey, come this way. And it just has to float in that way and not take a wrong turn and turn at Albuquerque. The pregnancy wheel is why we do not tell doctors when our last menstrual period was when we're pregnant. We tell them when we ovulated. Do not tell them when your last menstrual period was. Tell them when you ovulated and let them put that your last menstrual period was 14 days before that. Doesn't matter when your actual menstrual period was, because they're going to use this pregnancy wheel to determine how far along you are based on your last menstrual period. They tried to do it to me. And I told them, no, if you go by my period, you're going to be wrong. Ovulation in context, this is where it kind of shows you everything. How your hormone levels fluctuate, how the follicle goes into releasing the egg and turning into the corpus luteum, where your cervical position changes and it gets higher and more open, and then low and firm, where your cervical fluid goes from period dry, sticky, creamy, egg white, and then dry or sticky, temperature going down and then up, and pretty much just like a variable number of days, 12 to 16 days. After ovulation to your period, 12 to 16 days. Once you know when you ovulated, you know when your period's going to start. As a lovely lady with PCOS, knowing when I ovulate has been blissful. There's another section on endometriosis and how your chart might look with that. It really could look just the same, just you might experience more spotting, you might experience more heavy bleeding, cramping, things like that. Making sure that you mark your symptoms is going to be extremely helpful if you're searching for an endometriosis diagnosis. Basically, all of these endometrial tissue end up in places they're not supposed to be, and you have to have surgery to remove that scarring most of the time. Then we have polycystic ovarian syndrome. That's what I have. This is an ultrasound of a string of pearls on the PCOS ovary. Basically, this is how I was diagnosed with PCOS. I had a blood draw and I had an ultrasound. The blood draw showed high levels of testosterone. My ultrasound showed the string of pearls on my ovaries. Boom, PCOS diagnosis. So if you know you're having irregular or long cycles like this, notice how this chart looks a lot like that menopause chart I showed you. This is pretty much what my charts look like. Fibroids, these can occur in pregnancy and they can cause vaginal bleeding even if you're pregnant. And you might experience a bleeding fibroid and it may not harm your pregnancy at all. These can happen whether you're pregnant or not. But if you do experience bleeding while pregnant and it is not a miscarriage, it's likely to be a fibroid. This has a section on finding the elusive G-spot. This has examples of different types of vulva because we are all different and we are all shaped differently. So yours might look like this, or it might not look like any of these, and that is perfectly okay. Here's an example of a birth control chart. You notice that they mark right here what type of birth control method they used. So for example, this is somebody who they don't use a birth control method. They either withdraw or they just say, screw it, but they abstain entirely. They do not have sex during this window. Marks ovulation the peak day, waits until the 3rd day before resuming sexual intercourse. So that is what a birth control chart can look like, where you section off the days where you abstain from sex entirely. Yes, that is definitely possible. So fibroids can require a C-section. It's very much going to depend on what type of fibroid you have, where it's located, the severity, etc. Some women experience very, very tiny fibroids, and it ends up just causing a little bit of bleeding during their pregnancy, and they freak out and they go to the doctor and everything is totally fine. Others, they experience fibroids that are massive, that block the vaginal canal during pregnancy, and to the point where a cesarean is required. It's crazy how different they can be. Now, if you take this pregnancy chart and now you're like, oops, you know what? I want to be pregnant. Let's flip it to a pregnancy chart. You're pretty much just going to reverse that. And you're not going to mark which days you are using birth control because you're not using birth control. You're still going to mark which day you're ovulating, but you're going to want to have sex the most during these days. So it's very much the opposite, where you're avoiding these days. And then the greatest part is once you get to a certain point, you can pretty much be like, you know what? I am pretty positive I'm pregnant. I can go and take a pregnancy test and it's positive. And the greatest part is your temperatures are going to stay high. I actually kept my temperatures going through the first trimester with my son. And was it the full first trimester? It was at least the first 9+ weeks. It was at least until I went to see the midwife. But it was wonderful. And I got to see my temperatures and everything just so high up there, and it gave me such relief because I had that previous miscarriage, so it just gave me a little bit of relief. Here is a fun little chart that talks about how when you were in your mother's womb, all of the eggs that you will ever have in your life were in her womb. Isn't that crazy? Isn't that neat? My mom likes to point this out because it means the eggs that made my babies were inside her, because the egg that made me was inside her mom. And then the back of this book is all appendices, so you can look and get more information, more examples of charts, and just examples really is what most of this is. There is a frequently asked section. I highly recommend getting this book. It is chocked full of information. And she is about to come out with a 30th anniversary edition here this year. So if you don't want to get this particular book, she will be setting up a new one here soon. Next week, I'm going to be going over Cycle Savvy, which is the Smart Teens Guide, 14-year-old girls and up. I say girls, anybody with a period. You do not have to be a cisgendered girl. You can be a transgender man who simply just wants to track your own cycle. Totally fine with me. Please join. That goes for this one too. If you're looking back at this, I am all for everybody knowing how to track their cycle. I don't care what your pronouns are. You deserve to know about your body and how it works. So this one, it is a little old in that some of the information is a tad bit dated, just like this book. Some of the examples are a bit dated, but she goes over everything in a very teen-friendly way. She does talk about teen relationships. So I'm going to be reading this over this next week and coming up with a teen version for next week. Mostly so that way anybody who wants to share this information with their teenage daughter or teenage transgender son, they can, and it would be wonderful. It would make me feel so good if this information helps even one person. All right. Does anybody have any questions? Ooh, I've done a lot of talking. I'm so glad you love it. This was pretty much the last one of it because I've gone through now the entire book. Congratulations if you have gone through the series with me. You have gone through the entire book. It is really not that hard to read. And pretty much all of it ends before this section, so I mean, it's not the whole book. It's this book. You've gone through the book with me. I love this book so much. I hope you ladies have a great night. Thank you for joining me.